Today, on June 8, 2025, our understanding of complex medical conditions continues to grow, yet some topics remain shrouded in misunderstanding. Let's talk about one of them, HIV. The term HIV stands for Human Immunodeficiency Virus. It's a virus much like the flu, but with a very different and specific target inside our bodies. Its primary mission is to attack the immune system, which is our body's natural defense force against all kinds of germs and illnesses. Think of your immune system as a well-trained army, constantly on patrol to keep you safe. HIV is a clever invader that specifically targets the generals of this army, the cells that lead the fight. When HIV enters the bloodstream, it doesn't just float around aimlessly. It actively seeks out a particular type of white blood cell called a CD4 T-cell. These CD4 cells are absolutely crucial. They are the coordinators of your immune response. They are the ones that sound the alarm and tell other immune cells what to do and where to go when an infection strikes. HIV is like a spy that infiltrates the command center. Once inside a CD4 cell, the virus uses the cell's own machinery to make countless copies of itself. This process ultimately destroys the host CD4 cell, and the newly created viruses are released to find and infect even more CD4 cells. This cycle of infection, replication, and destruction is relentless. Over time, as more and more CD4 cells are destroyed, the total number of these important cells in the body begins to drop. It's a slow, steady process of attrition. The body tries its best to fight back and produce new CD4 cells, but it often can't keep up with the rate at which HIV destroys them. This gradual depletion of the immune system's commanders is what makes HIV so dangerous. Without treatment, the immune system grows progressively weaker, leaving the body increasingly vulnerable to outside threats it could once easily handle. It's important to understand that a person can have HIV for many years without showing any major signs of illness. They might feel perfectly healthy. During this early period, the virus is still active, quietly weakening the immune system behind the scenes. This is why testing is so critical. Knowing your status allows you to get the medical care needed to stop the virus in its tracks. With modern medicine, we can halt this process of destruction, preserving the immune system and allowing individuals with HIV to maintain their health and live long, productive lives, a reality that was once unimaginable. Now, let's clarify a common point of confusion: the difference between HIV and AIDS. As we've discussed, HIV is the virus itself. AIDS, on the other hand, is not a virus but a diagnosis. AIDS stands for Acquired Immunodeficiency Syndrome, and it represents the most advanced stage of an untreated HIV infection. A person does not automatically have AIDS just because they have HIV. In fact, with the effective treatments available today, many people living with HIV will never progress to the stage of AIDS. It's a critical distinction that highlights the success of modern medical science. A person is diagnosed with AIDS when their immune system has been severely damaged by the HIV virus. This diagnosis is typically made in one of two ways. The first is based on the number of CD4 cells remaining in the body. A healthy person usually has a CD4 count between 500 and 1,500 cells per cubic millimeter of blood. A diagnosis of AIDS is made when a person's CD4 count drops below a critical level, specifically under 200. At this point, the immune system is considered compromised, making it far too weak to mount an effective defense against infections. The second way an AIDS diagnosis can be made is based on the presence of certain illnesses. When the immune system is this weak, a person becomes susceptible to a range of serious infections and cancers that a healthy immune system would normally fight off with ease. These are known as opportunistic infections because they take advantage of the body's weakened defenses. The appearance of one or more of these specific, life-threatening conditions in someone with HIV is a clear signal that their immune system is failing and leads to a diagnosis of AIDS, regardless of their CD4 count. So, to put it simply, HIV is the cause, and AIDS is the potential outcome if the cause is left unaddressed. Think of it like this. Having high blood pressure is a serious condition, but it doesn't mean you've had a heart attack. However, if left untreated, it significantly increases your risk. Similarly, having HIV is the underlying condition, but with proper medical care and treatment, the devastating consequences of AIDS can be prevented. This is a message of hope, underscoring the power of early diagnosis and consistent care. When the immune system is weakened by HIV, the body becomes a battleground where it can no longer win the fight. This opens the door for those opportunistic infections we mentioned. These are not rare or exotic diseases. Many are caused by common germs, bacteria, and viruses that are all around us. In a person with a healthy immune system, these germs are usually kept in check and cause no harm. But for someone with a severely compromised immune system, they can become severe and even life-threatening. This is the harsh reality of what happens when the body loses its protective shield. The list of potential illnesses is long and varied. For example, a person might develop a severe form of pneumonia called pneumocystis pneumonia, or PCP, which is a leading cause of death for people with AIDS. Another common issue is tuberculosis, a bacterial infection that primarily affects the lungs. Oral thrush, a fungal infection in the mouth, and certain types of cancers like Kaposi's sarcoma, which causes lesions on the skin, are also telltale signs of a failing immune system. These conditions are not caused by HIV directly, but by the fact that HIV has disabled the body's security system. Beyond the physical toll, HIV can also have a direct impact on the brain and nervous system. The virus can cross the blood-brain barrier, a protective membrane that shields the brain from pathogens. Once inside the brain, HIV can infect brain cells, leading to a range of neurological issues. These can include cognitive problems, often referred to as HIV-associated neurocognitive disorders, or HAND. People might experience memory loss, difficulty concentrating, or confusion. The effects can range from mild, almost unnoticeable changes to more severe dementia-like symptoms that interfere with daily life. Furthermore, living with a chronic illness like HIV can profoundly affect a person's emotional and mental well-being. The challenges of managing the condition, combined with the potential for social stigma and discrimination, can lead to significant stress. As a result, mood disorders such as depression and anxiety are common among people living with HIV. These emotional struggles, combined with the direct neurological effects of the virus, underscore the importance of comprehensive care that addresses not just the physical health, but also the mental and emotional health of the individual. Despite the serious nature of HIV, the story today is overwhelmingly one of hope and progress. The key to this transformation is a powerful class of medications known as antiretroviral therapy, or RT. This isn't a single pill, but usually a combination of drugs taken daily. RT works by attacking the HIV virus at different stages of its life cycle, preventing it from making copies of itself. This stops the virus from spreading and destroying more CD4 cells. The goal of ART is to suppress the virus to such a low level in the blood that it becomes undetectable on standard tests. When a person starts ART early and takes their medication consistently, the results can be remarkable. An undetectable viral load is the gold standard of treatment success. It allows the immune system to recover, and the CD4 cell count can rise back to a healthy level. This means the body regains its ability to fight off infections. A person with an undetectable viral load can live a long, healthy life and has effectively zero risk of sexually transmitting the virus to a partner, a concept known as undetectable equals untransmittable, or U equals U. This has really revolutionized both HIV treatment and prevention. This is why early diagnosis and immediate connection to care are so important. The sooner a person knows their status and begins treatment, the less damage the virus can do to their immune system. Starting ART promptly preserves immune function, prevents the onset of opportunistic infections, and reduces the risk of long-term complications, including those affecting the brain. It transforms HIV from a fatal diagnosis into a manageable chronic condition, similar to diabetes or heart disease. It requires daily attention, but it allows people to plan for a full future. Ultimately, the fight against HIV requires more than just medicine. It requires knowledge and compassion. Educating ourselves and our communities is essential to dismantling the fear and stigma that have surrounded this virus for decades. Understanding that people on effective treatment can live full lives and cannot transmit the virus helps build a supportive environment. By promoting testing, encouraging early treatment, and showing empathy for those living with HIV,